Hello, this is Sharon Garrett, and today we're talking about lots of different topics. Everything from the new JCI accreditation for hospitals in the UAE through to how bereavement affects children. When you move here, all of the stress involved with moving to a new place, and particularly Dubai, and how it affects people in different ways. In our second hour, we'll be talking about sports medicine, thumb sucking in kids and its effect on their dental hygiene, and also habits. And we'll finish off the show with a stress buster of the week. And to start with, I'd like to welcome Mr. Atari, who is the Chief Executive Officer of Medcare Hospital, to the studio. Welcome to the show.
Thank you for having me.
We're talking first of all about the importance of the JCI accreditation, and I think it's interesting that the Dubai Health Authority recently announced that 3 government hospitals and a specialised centre for the treatment of a genetic blood disorder have already received international accreditation, and Rashid Hospital, Dubai Hospital and Al Wasl Hospital, and also this Thalassemia Centre, they've received the Joint Commission International Accreditation back in 2007. 2 private hospitals in Dubai have received accreditation so far, which is the American Hospital and, of course, today's guest hospital, the Medcare Hospital, while several others are still in the process of seeking accreditation. Can I ask you, what is it? What is the JCI accreditation, and why is it really important?
Simply saying, the JCI accreditation, it takes care from the patient aspects from the time of admission to the time of discharge. Basically, it's looking after the patient in all aspects. What's needed to be done in the hospital to make it efficient and to maintain quality and safety for the patient. As you know, all health organizations and hospitals, the goal for them is to deliver quality clinical care and services in the hospital to make sure that the patients are receiving the best treatment. Now, why JCI? Basically, right now in the Department of Health, we have decided that all hospitals and health organization must have accredited by one of the major accredited bodies in the world, like the American, the Canadian, and the Australian. So now it used to be an option up till recently, for a few months ago, where it's mandatory. Now that will assure the patient that this facility, if they are JCI accredited, that they will receive the high standard.
Why do you think the Dubai Health Authority had a change of heart from having it as an optional thing and then making it mandatory only a few months ago?
You know, basically as everything in Dubai is going rapidly increasing, and we're going to the international standards, best international practices. So the healthcare now is following up on the same track record. So the health department decided now it is the time for the health sector to be with the international standards. In the past it still was lacking, but now, and we can see in the future, in the next year, you will see a lot of regulations that will bring the health system completely in Dubai to very high standards.
So we have international playing fields.
Yes.
How long is the accreditation process?
Actually, it is for us in the hospital. We've done it in a record time, basically.
Look at you! You're looking very proud here in
Definitely. Actually, it starts with the vision of our chairman and the board members, which they decided that JCI comes first when the hospital start. So according to JCI, people, when they come and survey us and when they declare that we passed, we were one of the first hospitals in the world actually to be accredited in less than a year from the day opening. And that's actually, it's a lot of credit for our hospital to do it. One thing.
How long does it normally take? You've said less than a year for Medcare.
It will take between 1 to 2 years.
And do you always get it on the first go, or is it something that you can fail?
You could very well fail that, but we've been very determined to get it from the first time. I don't think that we got it from the first time, but it is a big process that it teaches the hospital or the staff to be a part of the team. the whole process developed a team sense in the whole hospital, because we cannot part of the hospital pass and the rest doesn't pass. We all pass together or we all fail together. So we all have to depend on us. So for a young organization like our hospital, it was very important to go this process early stage.
I guess it makes it easier doing it in the early stages and setting the groundwork and the right way of doing things than having to go into an existing facility years down the track, and then you actually have to do a change management program to get people to buy in.
Absolutely, because if you start with your own regulation or your own standard, you build a bad culture. And to reverse that bad culture, it takes many, many years to get everybody to think again. So when we started, JCI was our rules and regulation policies and procedures. So everybody who had joined the hospital, this is what they started with. It was very easy. They do it this way.
Can I ask you a question? Sometimes when you have policies and procedures, we have the policy, but a lot of people don't understand why. I know with programs like the Dubai Quality Award, which is an excellence model for companies in Dubai, it's important that their employees understand why they're doing things in this way. Does the JCI accreditation have the same emphasis that people understand why those policies and procedures are in place, or is it just there?
Absolutely, you're right. And actually, after doing it and after applying all these policies and procedures, the staff who's never been exposed to such regulations, now they say, absolutely, this makes sense. This whole thing has been, JCI is the daughter of the JCO, which is the American accrediting body in the U.S., and they've been developing these policies and procedures for about 50 years now. So it's not made overnight. So definitely there's a lot of work and research done to make these the policies and the procedures makes life much better for the patient, much safer, and the quality is 100%.
And I guess the staff, the employees know where they're going. It's not like going blindly to work every day. There's clear goals and a clear structure of how things should be done at the highest level.
Absolutely, and actually for the staff to be exposed to such process, it really elevates their sense of professionalism, and they really know that now they're dealing with very high standards that they were not exposed to in the past.
What exactly was involved during the assessment procedure?
Actually, it was a complete audit for the hospital from head to toe. It involved
everyone was working late nights.
Everybody, we were working many nights, but it is very thorough. It does not leave one section without. It looks at the housekeeping policy procedure. It looks at your most complicated anesthesia procedures. It looks at everything, your administration, and to your staff development. Even staff development is one part, is a very important part in this. So
what kind of things in staff development do they look at?
They look at one credentialing of staff. Where are these staff coming from? Are they really credentialed from? What are the process the hospital went through to make sure these licensing is correct? Many people come here with many degrees. So they look at the process, what kind of efforts the hospital made to make sure these licenses are legit.
Because I guess there's still a lot of false degrees out there, and also degrees which from one educational provider have less weight than perhaps another provider which would have a very tough degree program.
Absolutely, and this, they look into that very they want to see what kind of attempts you made to the university, the ex-employer. They want to see that you are really going to make sure that your staff you're using are qualified staff. And they look also what kind of training you do to your staff. If for 1 year, what have you done to increase their...
How many hours does someone have to do of continuing professional development in
At this time, there is none, there isn't any rules. I know the new regulations, I'm not sure it has not been applied yet, but there will be minimum accredited hours for doctors and nurses to keep this, and this is a very big step, which we were asking for, because doctors who came 30 years ago, you didn't know if they had any refreshing courses or not.
Absolutely not. I mean, just reading the journal, some of them probably aren't even reading the medical journal.
No, it became old medicine, basically. Now with the new regulation, as I said, Dubai, the Department of Health are coming with very fantastic, actually, regulations that will make sure that doctors and nurses be relicensed and continue with their education.
So what other kind of regulations? You seem quite excited about these new regulations that are coming. Can you share with us any of the other regulations that are coming?
Actually, one of them, the best one, is the JCI or the accreditation process. This is one will really cover a lot of the regulations. But if you are accredited, then you are there. And also they're looking into facilities and make sure all these facilities are fit to be a health facility.
We're going to take a short break, and when we come back we'll be talking about things like whether the hospital's records get audited and the number of post-operative infections. Are they audited? Keep it here on 103.8 FM.